Good evening, everyone, and thank you for joining us for our Pharmawise Health and Wellness series. This presentation is supported by the Kingsville Community Center, and the town of Kingsville has generously donated the use of Unico Hall to us for this presentation. You can view recorded sessions of our previous presentations on YouTube at the Kingsville Community Center's page. My name is Nixon. I am the owner and pharmacist at Main Street Pharmacy and Wellness Center here in Kingsville, and we're located next to the old Kingsville District High School. This evening we'll be talking about something that often bugs me this time of year: ticks and bug bites. In Essex County, we're lucky to usually have a beautiful spring and summer weather. This year we skipped spring and went straight from winter to summer. But this brings with it some risks, especially bugs of every kind. So, first let's talk about ticks. The majority of Essex County is considered an at-risk area for ticks carrying Lyme disease. This makes it especially important for us to be mindful of where we are when we're outside and observe appropriate cautions while we're in the wilderness and even in fields and grass, such as soccer fields. Ticks can bite you wherever they land. They don't attack a particular part of the body. They will get in at your hairline, neckline, ankles, armpits, wherever they can. Now the good news is with ticks, they usually need to be attached for at least 72 hours or 3 days in order to transmit Lyme disease to the person if they are infected. But even up to 48 hours, there is a potential. The amount of blood that a tick has gotten from you is a good way of telling how long it's been attached. The more swollen the belly of the tick is, the longer it's been on you, the higher risk you are for getting a potential risk for Lyme disease. As we can see here in our nice little map from the province, Ontario has a large number of areas that are considered high risk, but you'll notice that in Essex County, almost the entire south and west portion of the county are considered high risk, especially Point Pelee, where there's not much that is trimmed or maintained, as it is a national park that's meant to be maintained as a wilderness state. So especially if you are visiting these areas, make sure that you're using proper cautions that we'll discuss later in the presentation. The good news is pharmacists in Ontario are now able to prescribe to certain patients with high-risk tick bites to help prevent Lyme disease. This is a change in the last couple of years where you used to have to either go to your family doctor, go to a walk-in clinic, or go to an emergency room if you'd been bitten by a tick in order to get preventative antibiotics. This is now something that we are able to do in our scope of practice to help really increase access of care for what can be a very high-risk condition with a very low-risk preventative treatment. We can prescribe only if the tick is suspected to have been attached for more than 24 hours, and we can't prescribe for patients who are pregnant or breastfeeding. The tick has to be, or strongly suspected to be, a black-leg tick, and it has to be a bite from one of these high-risk areas that are indicated on the yellow portions of the map here. But as I say, the majority of Essex County is in that high-risk area. So if you are in our part of the woods, as they say, if you find a tick on you, make sure you access appropriate medical care timely. And this is because Lyme disease can have some pretty significant long-term health complications if left undiagnosed, untreated, and unprevented. It's a infection caused by a bacteria that are transmitted by the tick bite. And as I said, it's usually only the black-legged ticks that are infected with Lyme disease. Now, that's not to say that any other tick bite is going to be low risk. There are certainly other medical conditions and bacteria that can be transmitted through tick bites. Lyme disease is just the most prevalent in our area here in the county. The size of a tick ranges from about the size of a poppy seed all the way up to the size of a sesame seed. And that makes it a lot more difficult to spot. And unlike mosquitoes, where when you get a mosquito bite, you know you've been bit because you feel the itch almost right away. The ticks you don't really notice unless you're looking for them. They latch on, they bite very small, and they just slowly bring the blood out of you, unlike the mosquito, which lands, draws it out quickly, and leaves. This leads to the issue of attachment, which is why we need to know how long it's been since you were in the exposed area, how long the tick's likely to have been attached, because the longer it's on, the more it regurgitates the blood and what's inside of it into you, rather than just feeding like a mosquito does. They are very difficult to spot, as I've already said, but Lyme disease can cause some severe complications if left untreated, but if caught early, can only usually causes very mild symptoms. One of the biggest hallmark symptoms we look at when we see someone who has potential Lyme disease is the kind of bullseye rash, we call it. You'll see on the right side of the slide there. It really does form those kind of red and white rings that look like a dartboard or a bullseye. It can also cause fever, headaches, just general feeling down physically, and that's why it's very hard to determine if it's Lyme disease or not, because, well, headache, fever, and body aches and just feeling run down can be caused by a lot of things, and often we won't jump straight to Lyme disease unless we know that you've had a tick bite or have been in high-risk exposure areas. When we're looking at symptoms, when do they develop? Usually 3 days to about a month after the tick bite for the mild symptoms, but those severe symptoms can occur days to months after the bite and after the initial infection phase. Lyme disease, like I said, is usually diagnosed based on that characteristic bullseye rash that you can again see here. You can see the inner, the outer ring, and then the further ring on it. If you suspect that you've been bitten by a tick and you find one on you and you think it's bitten you because you see it a little bit swollen, keep it. Put it in a Ziploc baggie and then put that Ziploc baggie in another Ziploc baggie and bring it to the clinic, bring it to the doctor. They will be able to send it off for testing to know for sure whether the tick has Lyme disease or not. If you think you've been bitten and the tick's no longer on, you should still seek out care because it can still be treated even if the tick is no longer attached to you. Just having the tick does help in the long run. So what can I do to prevent myself getting bit by a tick? Well, the obvious thing is to cover up, especially if you're going to be on wilderness hikes, out exploring Point Pelee, going through the wooded areas at Fort Malden or Micmac Park in Tecumseh, covering up, making sure that you're wearing socks and then tucking pants into them if you're going to be in those really wilderness exposed areas. Having tight fitting cuffs on your sleeves, wearing a hat with a wider brim to help prevent them from dropping down on you from above. These are things that are very easy to do to help prevent you from getting bit by a tick. Using a DEET or a cadron containing bug repellent has been shown to help. Ticks are averse to that, the same as mosquitoes and other bugs are. Also, using appropriate caution in checking after you've been in a high-risk area. When you come in from a hike or come in from the point, just do a quick search on your body in these common areas. Around your ankles, feel in your scalp to see if you can feel anything in there. Behind your ears, the knees, if you're wearing shorts, are also very common areas for ticks to attach because you don't tend to notice them as much as you're moving. If you've been in a higher risk area, ticks may not just be on you, they could be on your clothes as well. And so a very simple way to ensure that any tick that did come home with you isn't going to attach to you and bite later on, toss your clothes in the dryer for 60 minutes on high heat. This will kill any of the ticks that have gone on there. And as I said, it's very hard to notice them because they are quite small. So sometimes if you've been higher risk, using this as a precaution is the best way to go. Lastly, you can take a shower as soon as you get back from the wilderness areas to wash off any ticks that may be on you but have not bitten yet. A hot soapy shower will help, also with the grime from the hiking trail, but will help to wash off any of the ticks that are on as well. That's what to do if you're in a wilderness area, on a hike, in a park. But what can you do at home to help prevent this? Keeping your grass mowed short, the ticks like living in shade. They like the shaded woody areas, that's why they're commonly found there. Keeping your grass mowed short prevents them from having a place to thrive, as well as keeping your trees and bushes trimmed back to allow as much sunlight in as possible. If you live in an area where you're on the border of a wooded area, some parts of Kingsville back up onto Jack Miner Sanctuary, and other parts that are of the county that are unmaintained because they are wilderness preserves, you can create a border with gravel and wood chips between your lawn and the wooded area, and this will help to prevent the ticks from as easily crossing from the woods into your lawn, into your yard, and into your home. Fence or physical barrier, if you're in an area that has a lot of deer, can also help. This is because deer are a very common carrier for the ticks, and if they're wandering into your lawn, your property, they can drop those ticks off when they're in your area, and that's a risk factor as well. So using a physical barrier to keep them out also helps. So I've been bitten by a tick. Now what? First thing we want to do is always use the appropriate tools for the job. Burning the tick off, using nail polish remover or nail polish or Vaseline to remove it, not going to be effective. What we want you to do is use tweezers or a dedicated tick removing tool. Some of them look like really little claws that you would find at the arcade games. Some of them look like little spoons with an indent in them that you fit the tick around. But using one of those three tools is going to be your best bet. You want to get as close to the head of the tick as possible. So if you're using the scoop, it just slides right along the skin and cups the rest of the body while the base remains flat against your skin. If you're using tweezers or the claw, you want to make sure that you are grabbing it as close to your skin as possible. And this is because if the bacteria is in the head of the tick, so you don't want to leave that in there. We want to pull it out like we would with a bee stinger. And so we don't want to squeeze it too hard either, because that will potentially pop the head off. So we want gentle pressure and pull it straight out. You don't want to twist it. You don't want to rotate. You just want to pull straight out. After that, as I've said, you want to secure the tick. If you've found it, to remove it, put it in a Ziploc baggie, and they are very adventurous escapees. So sealing that into a second Ziploc baggie with the opening of one away from the opening of the other will help to ensure that it stays contained. Then you're going to want to clean the tick bite. Just warm soapy water is all you need to do. And then go to your local walk-in clinic, health unit, your family doctor, or now, and I haven't updated this slide apparently, you can also go to your local pharmacy to get a preventative antibiotic. So how do we treat Lyme disease, I guess we'll start with. If you suspect you've been bitten or you have symptoms of Lyme disease, if you have symptoms, if you have that bullseye rash, you need to go in to be evaluated by a physician or a nurse practitioner. It's usually able to be treated with a course of antibiotics. If you start those antibiotics within 3 weeks of the bite, it is shown to be very effective. Untreated Lyme disease can lead to some more serious complications, numbness, arthritis. Of course, death is the outcome of pretty much anything we get, including life. So we say that on there, but that's in the very, very extreme cases. Usually in this part of the world, at least, we can catch Lyme disease early enough to prevent it from getting anywhere near that point. If you've been bitten and it's been within that 72 hours of the bite, and the bug was attached for at least 48 hours, what you'll often be given is a single dose or a single day course, depending on the antibiotic, which can help to prevent you from developing Lyme disease from a suspected high-risk tick bite. With that, it's a very simple, very easy antibiotic, either 1 dose or 3 doses, depending on the antibiotic, and that's it. Otherwise, if you suspect you've already got it, if the doctor suspects that, or you have relatively minimal symptoms, a 2 to 3 course of an antibiotic started within the first 3 weeks has been shown to be very effective in preventing symptoms from occurring. So, what can we use as natural tick repellent? As we know, a lot of people don't necessarily like using DEET or Acadrin regularly. They are very effective products, but they do have their own issues, as do any of the natural repellents that we can use. They are not nearly as effective as the chemical agents, but they are oftentimes less irritating to the skin, especially for people who have sensitive skin, and can also be applied to your garden, to your lawn, such as with garlic oil. Rosemary, lemongrass, cedar, these are all things that can be used on your skin, on your lawn, and on your gardens to help try and keep ticks away. It's not going to be fully effective, and it's not going to be as good as using a true insect repellent, but it will help. So remember, don't let a tick make you sick. Wear repellent, check for ticks after you've been outside, shower as soon as you get in from being outdoors, and call your doctor if you develop a fever or rash. And again, I just want to stress, this is not just in the wilderness. This can occur on playgrounds, soccer fields, anything like that. So using caution, making sure you're checking over yourself during these high-risk seasons is always going to be the best option. So now we'll move on to mosquitoes and other bug bites and what you can do to help prevent and treat anything that you might get from those. So mosquitoes, we know, can transmit a whole range of other diseases besides just causing the itching. I'm not going to be covering any of those conditions because they are very varied depending on where you are in the world, as well as the season and the type of mosquito. So we'll just be focusing mostly on prevention, as well as how you can treat the minor itching and welts that can occur from mosquito and other bug bites. Prevention is always the best option. It's better to prevent a bite than to treat it. So the best ways to do that are either with chemical prevention, natural prevention, or I didn't add this on here, but the same physical prevention that we discussed when we were talking in ticks, covering up, making sure you're wearing clothes that don't attract them and that you're wearing clothes that they can't get through is always going to be helpful as well. But as they're often out in the summer, I don't know about you, but I don't like walking around in a suit during the summer. So chemical prevention, we can use, again, DEET or Acadrin to help as insect repellents. The clip-on mosquito repellents do not work. There's been a lot of data that shows they're expensive accessories. However, one thing to note when we're talking about insect repellent in general, especially during the summer and the spring when we have a lot of sun, is you'll often want to apply sunscreen and bug repellent at the same time. Always apply the sunscreen first. The insect repellent goes on second, and if you can wait 15 minutes between applying the sunscreen and applying the insect repellent, that will help both work optimally. This is because the insect repellents partially work on smell, and if you apply them before the sunscreen is going to block that, so the mosquitoes and other bugs will get closer to you. Part of it is because some of these chemicals have been shown to help reduce the effectiveness of the sunscreen by preventing it from blocking some of the UV rays. So order of application is important. Make sure you're doing your sunscreen, then your bug repellent. Natural prevention, of course, the other oils that I mentioned earlier in the presentation can be helpful, but the CDC actually endorses lemon eucalyptus oil to prevent mosquito bites as effective as DEET. So for those of you who are looking for an alternative, it's been studied in well-done scientific studies that have shown it is nearly as effective as DEET and can be used in place of it. But it's important to note that it's not eucalyptus oil, it is lemon eucalyptus oil, which is different from the more commonly found eucalyptus varieties that you see in the oils in different stores. So, you got bit, now what? We can treat the itch very easily. We can either give you, for adults and kids, as young down as we can go, we can treat you with over-the-counter hydrocortisone cream, over-the-counter antihistamines to help treat the itch and prevent some of that itch from occurring. Cold compresses on the bites will also help to slow down the itch and the development of a welt. The creams are usually applied twice a day, and Benadryl is the most commonly used medication to help treat an acute itch from something like a bug bite. Just know that it can cause drowsiness, and so use it with caution, especially if you're going to be driving, and make sure that if you're giving it to your kids, you are looking at the dosing carefully and making sure you're giving them the right product and the right dose, because the concentrations between the adult and the children's Benadryl are different. Topical Benadryl. A product that's been around for a while, is not very well liked and has very little data for its use. And we usually recommend avoiding it because it does have some absorption into your system from just topical. And oftentimes, if you're using that, you're also going to be using the oral Benadryl, and that can lead to an accidental overdose, as I discussed in our last presentation on some of the risks associated with over-the-counter medications. So, another good news is pharmacists can now prescribe for insect bites and stings. We can prescribe a little bit more potent products than you can get off of the shelf over the counter. And this is a good tool in our arsenal because it's really something you don't want to take up your family doctor's time with or go to sit in a walk-in clinic for, but it's annoying having a bug bite. We have all had them. We all know how itchy and irritating they can be. So your pharmacist can now prescribe certain medications, both topical creams and ointments to help with the itch, as well as oral medication that's less sedating than Benadryl or a little bit less effective, but a little bit safer to use as well. We can't prescribe if you've had a severe allergic reaction to a bug bite in the past, but if that's the case, you know you've got that because you've had that reaction. You'll likely have an EpiPen and an emergency plan already in place, and coming to see us is one of the last things that's going to be on your mind as soon as you get bit. And that is all I have for this evening. I know this was a bit of a shorter presentation compared to some of our previous ones, but it really, I want to drive home the point of this presentation just before we end, which is preventing always comes before treating. If we can prevent you from getting bit, prevent you from having a reaction or an exposure, always going to be better than treating. So again, I would like to thank the Kingsville Community Center for hosting us for this presentation, and the Town of Kingsville for providing us with the space to have you all in for this, this evening's presentation. We don't currently have our next session scheduled, but keep an eye on both our social media at Main Street Pharmacy and Wellness Center and the Kingsville Community Center's social media as we announce our next sessions, and I hope to see you all there. I hope you found something useful in this presentation. Thank you, and have a good night.